And I'm very pleased to welcome our guest speaker from Atlanta, Georgia. Her name is Megan Gordon. She's a Georgia native who loves her home state but knows that it can be better. She grew up in Norcross and received her bachelor's degree from Warren Wilson College in North Carolina. She then returned to Georgia to attend law school at Emory University. Now, while she was in school, Megan took her lifelong passion for helping people and focused it on fighting for reproductive justice. She now lives these out in her capacity as the Public Affairs Coordinator and lobbyist for the Feminist Women's Health Center up in Atlanta, Georgia, where she fights for better state laws and helps other Georgians discover their power to do the same. In her free time, she enjoys yoga, books, and inching towards actually running an entire 5-kilometer race. She also brings with her one of her interns, Liz Rary. Liz, I figured that was you because you had a stack of papers. Okay. All interns always carry the papers and the books. She is a first-year law student at Mercer. In her undergrad, she acted as a sexual assault survivor, advocate, and peer facilitator for nonviolence workshops. In the past year, she has worked closely with the National Lawyers Guild and Students Against House Bill 51, and she is currently a Bewley Fellow at Feminist Women's Health Center up in Atlanta. And with that, let's give a warm welcome to Ms. Gordon and Ms. Riddle.
Hey y'all. Can y'all in the back hear me okay? Yeah. Alright, if at any point you can't, just give me this guy, okay? Cool. Also wanted to thank Liz again for coming. Liz is actually, she's not my intern, she's one of our Aaron J. Bewley Leadership Fellows, which I wanted to shout out that program for y'all because she lives in Macon and she does it too, even though we are in Atlanta. So if you know young folks who would be interested in a program for leadership training and activism work, no matter what they're interested in, we can do that. Talk to Liz. I'm volunteering you for this, but cool. Alright, so we have a lot to cover in a little bit of time. So I'm going to try to just move like this through the material, and then as we get through each section, I'll stop and ask if folks have questions and open up space for that. Does that feel okay? Cool. And if we're fast enough, we have some bonus lobbying exercises at the end. So we have some motives to get through quick, so we can do that. Alright, so first just a little bit about Feminist Women's Health Center. Our mission is to provide accessible, comprehensive gynecological health care to all who need it without judgment. We also work collaboratively within our community and nationally to promote reproductive health rights and justice, and to advocate for wellness, health information, and fair public policies by educating the community and empowering people like you and our clients to make their own health decisions. We are an abortion provider in the state of Georgia, which is where a lot of our work comes from, because you can't sit on the sidelines when you're doing this work in the state of Georgia. We serve approximately 5,000 to 7,000 folks in our clinic every year, and we serve 10,000 to 12,000 more in our outreach and education and advocacy programs. We have a Lifting Latino Voices initiative and Black Women's Wellness programs, which are specifically designed to improve the health care of those marginalized communities, which historically have worse health outcomes than white people. We do a lot of advocacy work as well. This is my area of expertise. We have a lobbyist, me, at the state capitol during the legislative session. We are a regional coordinator for the Raising Women's Voices initiative, which is a national program around protecting the Affordable Care Act. When necessary, we testify at hearings in the state legislative session. We provide talking points, position papers, whatever is needed to move good legislation or stop bad legislation. If you want to keep up with that, you can sign up for email alerts through our Feminist Advocacy Network. We have sign-up sheets in the back, I think, if you want to get on our listserv and hear more about what we do. And we can do in-district lobbying visits as well as advocacy days to the state capitol. Not everyone can make it to the state capitol. Case in point, it's a long drive. But you can access your legislators, both your federal and state and city, while they're here, and just like meet with them in their office and chat about issues that are important to you. And I know that a lot of y'all have been doing that, which is fabulous. And if you want or need some extra support, I'm happy to help with that. All right, so what are we going to do today? We are hoping to leave with a strong foundation in the policy landscape around reproductive justice. And to know where to find data on the issue and navigate sources so that when you have questions or want to know like what's happening in this space, you know where to find that information yourself and you don't have to wonder or call other people. And we want to build skills in choosing what direct actions you want to take, who you're going to target when you're lobbying, and to get more comfortable with that like actual lobbying interaction. Does that feel good? Mm-hmm. All right. So first, I want to say this is a safe space. We're all learning here. There are no stupid questions. I'm still learning this stuff too, I promise. So like ask whatever question you feel like asking, and let's promise not to like roll our eyes or anything like that, all right? Yes, sir.
What does your shirt say?
Feminist Women's Health Center.
On the back.
On the back.
Oh.
I can't read it. I don't remember the exact word.
Oh, well, just do that.
Huh?
Just stand there.
Yes,
Okay.
to tell a woman everything she may not do is to tell her what she can do. Smash Road.
Thank you.
Yeah.
All right, we ready to? Yes.
On your first page, one backslide.
This one?
The top part, yeah. How much of that is being done outside of Atlanta?
None, because we only have one clinic. So we just have the one building in Atlanta. The state of Georgia has about 12 abortion providers. Most of them are in the city of Atlanta, unfortunately. And there's a lot of city zoning laws and other things that go into where clinics are able to exist. It's very hard to keep an existing clinic open, much less open up a new one. So unfortunately, a lot of folks end up driving a long way to access services. Yes, ma'am.
Well, that leads into my question is, like, from how far away do people come to access care at your clinic?
We get folks from all over the Southeast, especially up until a few years ago, Georgia passed, and we'll dig into this law more in a little bit. A few years ago, Georgia passed a 20-week ban on like any abortions after 20 weeks. Up until that point, we were the only state in the Southeast that still did them. And so we were getting people from Louisiana and from like Virginia, like all over. And we still, like Alabama has one clinic, Mississippi has one clinic. So we still have folks driving from all over the Southeast to access services. That seems like a really good segue into, actually no, it's not. That was a terrible transition. I'm sorry. Before we dig into the laws, which comes after this, we're going to dig into some vocabulary real quick, all right? So, there's 3 different things that you may have noticed coming up in our mission statement: reproductive health, reproductive rights, and reproductive justice. They're all related, they're all overlapping, and they're all slightly different. So we're going to take a minute to parse out that language before we move on. Reproductive health is like your physical health needs. Access to care, your doctors, your medicines, state of physical well-being, and not just absence of illness. Reproductive rights are the legal barriers to like accessing things you need for your reproductive health. So strictly laws, things like that, 20-week ban I just mentioned, reproductive rights, Roe v. Wade, reproductive rights. And then we operate at Feminist out of the framework of reproductive justice. It's important to slow down just a minute here and acknowledge that reproductive justice was created by Black women out of a recognition of the fact that white feminism and its focus on reproductive rights was failing them and was not meeting all of their needs. Reproductive justice is defined in a bunch of different ways, but we use this 4 cornerstones of reproductive justice definition. So we focus equally on your ability to determine whether and when to have children, your ability to have a healthy pregnancy, ability to parent and to do so with dignity, and the ability to have safe and healthy families and relationships. So if you can easily access a safe and legal abortion, but you can't get prenatal care, that reproductive right is not particularly meaningful. Or if you can easily decide whether or when to have children, to have as many children as you want, but the minimum wage is so low that you can't feed them, or you can't take a day off work to care for them when they're sick, again, not a full reproductive justice happening in the world. Do we have any questions about those distinctions? All right. So, as I mentioned, this reproductive justice was founded because essentially white women were leaving black women out, and were forgetting to center race, gender, and class and thinking about the issues. Because, I, as a middle-class white woman, don't necessarily have to worry that much about whether the minimum wage makes it easy for me to take care of my family. So it's important for me, in my own activism, to pause and step back and think about, how does this law that might not affect me, that I might immediately think, meh, not that big a deal, how would that impact people who are less privileged than me? If there is, I don't know, if you open up a clinic next to a police station, or a ICE office, how might that impact the immigrants feeling safe accessing their care? That's something that I, as someone who does not deal with those issues, have to always stop and think about. How would this impact people who don't have insurance? How would this impact LGBT folks? So we always have to stop and pause and think about centering those folks who are really on the margins, because if, and this is something that we believe strongly in at Feminist, if a low-income black trans single mother who didn't graduate high school can access reproductive health care and get all that she needs, we're pretty sure that everyone else will be lifted up while we're focusing on this woman, right? So we always try to center the most marginalized in our work. Any questions about that? All right, we're going to move on to the real nerdy stuff, okay? So, key cases and other important law things to know about. Roe v. Wade, 1973, legalized abortion. 3 years later, we have the Hyde Amendment, in which a senator named Hyde, I believe he was from South Carolina, stood on the floor of the Senate and said, I would love to stop all women in America from accessing abortion. I do not have that power, but what I do have is the Medicaid bill. So I am going to make it impossible for Medicaid to fund abortion. This has been that way since 1976. It's the amendment just keeps getting added on to the budget or some other must-pass piece of legislation every year. So this has stayed in effect since 1976, coming out of this explicit acknowledgement of, I don't have power over women with means, but I do at least have power over low-income people. So we're at least going to try to control their decision-making. So, since 1976, the no Medicaid funding has gone for abortion unless someone is literally going to die. Is the only time, and rape and incest. Very narrow exceptions, also kind of difficult to prove, especially when you get into all the other barriers like gestational limits to does everyone who is raped file a police report? No. How do you prove that, and how do you do it within 20 weeks? If your state has a cutoff like that. So it really puts abortion out of reach for people who use Medicaid. And I also want to step aside for a moment and point out that when, all of this talk about Medicaid funding for Planned Parenthood and defunding Planned Parenthood, I try very hard to never use the word defunding Planned Parenthood, because that makes it sound as if Medicaid is funding Planned Parenthood, right? And that's not what they're doing. They're blocking Medicaid reimbursement for treatments other than abortion, like gynecological care, other things that would be reimbursed at any other medical provider, simply because they don't like Planned Parenthood. They're not funding abortion, haven't been for a long time. So, but we do have a bill that has been introduced this year called the Each Woman Act that would end the Hyde Amendment. I am blanking on the name of the folks who introduced it. Unfortunately, I could look that up for y'all later if you want to know. But call your folks, tell them to support the Each Woman Act. be great. Chances of it moving, let's be real, not super high, but we're gonna keep trying, and one day it'll work. Another important case to know about is Planned Parenthood versus Casey. That was in 1992. If y'all have ever heard the phrase putting an undue burden on like the right of abortion, that came from Casey. This case said that states can put restrictions and barriers on access to abortion as long as they do not impose an undue burden on the right. So for decades we're in this like place of courts being like, okay, sure, you're burdening this, but how much are you burdening it? Is it too much? And that's where we were until about last summer with Whole Woman's Health v. Hellerstedt. And the recent trend, and we'll dig into this more in a minute, the trend in anti-abortion legislation in the last few years has been to pass abortion restrictions in the name of women's health and safety. Things that, and again, I'll dig into this in a minute, but things that don't actually have that much of an impact on women's health and safety. But for decades, the court would basically just take the state's word for it and be like, okay, well, you say this is necessary, and so we're going to factor that in when we're deciding whether this is too much of a burden. In Whole Woman's Health, the court basically like called them on their crap and said, okay, if you're going to say that this is for protecting health and safety, you have to prove it. And you have to come with your evidence that this thing actually protects health and safety. And in that vein, struck down some abortion restrictions out of the state of Texas and set a new legal standard that I'm really excited to see playing out in cases about abortion restrictions to come. So, I just hinted at this, national trends. Some of these things happen in Georgia, some of them not so much. We'll dig into our state in the next slide. But these are just some things that we see happening a lot in states around the country. TRAP laws stands for Targeted Regulation of Abortion Provider. Essentially, regulations that apply only to abortion providers that do not apply to any other medical care provider. This is usually where you see the like women's health and safety things. Things like you have to have hallways that are X width wide. You have to be a certified ambulatory surgical center, which is like essentially a mini hospital. Some states apply that requirement even to clinics that only provide medication abortions, so requiring like big hallways and gurneys and all of this surgical equipment for clinics where people only come in and take a pill and then go home. And the idea here is just to get like a death by 1,000 cuts. Like no one thing is necessarily that burdensome. But when you have to be an ambulatory surgical center, that makes it really hard to get a space. That can cost millions of dollars in renovations to your building. And then you might have to have X amount of drug that you never need in your clinic, and you have to replace it every 3 months when it expires, and that's like $2,000 down the toilet, and all of these things stacking up to make it very hard for clinics to stay open, usually in the name of patient health and safety. Gestational limits, just cutoffs at any point. Georgia is at 20 weeks right now. Race and sex selection bans have been introduced in other states. None have ever been passed because they're pretty blatantly unconstitutional. They're usually based on racist stereotypes, such as like, we're worried about Asian women selectively aborting girls. So when you see a patient coming in, ask about their medical history and get all this information just in case. They've never been passed, thankfully, but they're the new frontier. Method bans, states banning specific methods of performing abortion, just because. Targeting public funding and private insurance companies. Again, we'll get to this in the next slide, but in Georgia, for example, you cannot, plans that cover abortion cannot be sold in our state exchange. That was also in the, some version of the Better Care Reconciliation Act, it might have been all of them, prevented this premium assistance and subsidies from going towards plans that covered abortion, unless you were like actually going to die. So just really getting at like nitpicking these things so you can't have insurance coverage for this, and of course Medicaid funding for services at Planned Parenthood. State mandated counseling and waiting periods. In Georgia, for example, you have to wait 24 hours after hearing a script mandated by the government with information about things like child support. You have to hear that and then wait 24 hours before receiving an abortion. In Georgia, you can do that via the phone. In other states, you might have to drive to the clinic and then drive back as much as 3 days later, which puts all kinds of burdens, right? If you have kids, if it's a long drive, if you have to take all that time off work, it makes it very difficult for people to access abortion in some states. Also, especially as we go into the opioid, as we deal with the opioid crisis, we've seen states criminalizing mothers and pregnancy outcomes, especially if they have children born with neonatal abstinence syndrome. And we have seen in other states, thankfully not yet in Georgia, women who have miscarriages being prosecuted and convicted for like self-inducing an illegal abortion, and examining the circumstances of their miscarriage and what brought them to the hospital. Just because, I don't know, just to make life harder, I guess. A lot of these things don't make sense, and so I want to give an explanation, and I just don't have one. So, speaking of things I can't always explain, Georgia law doesn't always make a whole lot of sense. So, we also have implemented the Hyde Amendment in Georgia's Medicaid program. Technically, it would not necessarily prevent states from using, say, their own state funding in the Medicaid program to fund abortion, but a lot of states like to hide behind the Hyde Amendment and be like, no, we can't do it. Restrictions on abortion coverage for plans sold at our state exchange. We have parental notification and judicial bypass for minors who need abortion. So if a minor needs access to abortion, clinics are required to notify their parents. Technically, consent is not required, but of course, the dynamic of that relationship is such that if the parent doesn't consent, it's probably not going to happen, right? This poses obvious problems for situations of abuse in the home, for example, or just situations where it's like, if you ever get pregnant, we are kicking you out of this house. People in those situations go to court in a procedure known as judicial bypass, where they actually have to go in front of a judge and explain to the judge why it is not in their best interest that their parents be notified and like what harm might be suffered, and explain that they are mature enough to make this decision. The outcome of that process tends to depend a lot on how the judge personally feels about abortion. And it can be really tricky, especially in small towns, to go through that with the anonymity that would be required. And sometimes judges can use that as an excuse to like shame and blame young people for being pregnant and wanting an abortion. It's not a great process. Georgia also has a hard cutoff, no abortions after 20 weeks under pretty much any circumstances. I could stand on that soapbox for a long time because a lot of fetal anomalies come up after 20 weeks. And if someone comes into our clinic 22 weeks pregnant and they are not able to carry their pregnancy to term, like despite all their best wishes, the best we can do is tell them to go to Colorado or New Mexico because those are the closest states that will help them. We also have the Women's Right to Know Act, which is our mandatory bias counseling law with that 1-day wait period and that phone script. Sex education mandated by the state must be abstinence only. States, public schools are not allowed to distribute any contraception. They cannot have any funding for it. They cannot talk about abortion or refer to abortion providers. But we do fund crisis pregnancy centers to the tune of $2 million. I will dig into crisis pregnancy centers in the next segment. Does anyone have any questions so far? Yes.
What if a young woman is in foster care and has no relationship to her parents? What does she do? Does she have to go through the judicial system?
Yep.
And in the contraceptives, do they have condoms?
In schools?
Yeah.
No.
Well, no, we had it in our adolescent unit in a hospital. We had condoms.
They don't do
Kids
that.
going out on leave, yeah.
Amazing. Nope.
They probably don't anymore.
They do, if you're interested in doing this. So the state, all of these laws are state laws. So the state mandates abstinence only, and the state mandates no contraception. But your county school board is the one that decides what's on the curriculum. And we are seeing in other counties parents advocating with their school, like, okay, I know you can't, you have to be abstinence only, but at least tell them how condoms work. You have the power to do that. So if this is something that you think is outrageous and needs to be changed, I encourage you to reach out to your school board and see what they're willing to do on this matter. Because within these parameters, they do have a lot of leeway to give folks a good education to keep themselves safe and healthy. Any other questions? Yes.
You mentioned the mandatory script.
Mm-hmm.
How fact-based is the mandatory script that y'all didn't create?
So we actually had a researcher that we know went through it, and she's like an expert in research around sexual and reproductive health out of UTA. And I haven't read through her whole research, but she concluded that 25% of the statements in that script and the booklet we have to give them are medically inaccurate. Yes.
Follow-up, are you allowed to tell them that?
Yes. So the great thing about the First Amendment is they can tell us to say a thing, but they cannot tell us not to say something. So the council can be like, I am required to give you this booklet that is 25% inaccurate. I am required by law to tell you this thing that is not true. And then you tell them and you've done what you're allowed to do and what you're required to do. And there's great, if any of y'all have ever seen the documentary Trapped, which I highly recommend, it gets into those trap laws that I told you about and really illustrates those very powerfully. There's a scene where Dr. Willie Parker, who's a very well-known abortion provider, is basically going through that script and he's like, I'm required by law to tell you blah, blah, blah thing. It is not true. I am required by law to tell you this. Also not true. It's great, but I digress. Any other questions? Yes?
I'm wondering if all of the legal restrictions that are placed on abortion, how that's affecting women who are having miscarriages.
That's a really good question. So, especially when you get into later terms of miscarriage, the body does not necessarily expel the miscarried fetus, right? And so there has to be a procedure to remove it. That is an abortion. We try not to use that language with folks who are experiencing that, because for obvious reasons that's really hurtful, but like there is no legal distinction between those patients and our other patients. So they still have to do that script and that waiting period.
For someone that has happened.
Yes.
Oh, God. See, I had multiple miscarriages, and it was awful. And I'm just going in my head, what if those laws were in place when that happened to me?
Yeah,
It
and
would've
then
been
of
that
course the
much more
20-week
awful.
ban,
Yeah.
if anything happens after that, or if you go to your 20-week checkup and realize that like your baby is not going to
So
live.
they don't depend on the doctor's.
Nope, like that is
decision.
a pretty hard cutoff. There is nothing that can be done in the
But
state
even
of Georgia.
before, I'm thinking even before that cutoff. I mean, if your doctor says the fetus is dead, are they still going to go through all that crap with you?
They have to go through all the same crap as everybody else.
Another reason for these horrible laws to get strict.
They make no distinction. It's extremely cruel. Yes, ma'am.
Can't the state be sued for practicing medicine without a license?
I wish. There is the precedent set by Whole Women's Health last year where they said that like your laws actually have to protect people's health and safety. That does offer some hope for litigation, but so unlike Roe, where like once they passed Roe, like abortion is legal across the country, Whole Women's Health was much more narrow. They struck down like the one law in Texas and set a new standard for like any future cases. So if we want to sue over every single law in the state of Georgia, and we could relitigate that. Oh crap, oh, one other thing I wanted to say about that. We did introduce this past legislative session in the state, and it will be around next session too, the Whole Women's Health Act, which would repeal women's right to know, this mandatory counseling law, and put into Georgia's law the standards set forth in the Whole Women's Health case, that like people have a legal right to abortion, and if you are going to put any burdens on that, they have to actually be rooted in science and people's home. Yes?
Going back to people who have miscarried or suffered a fetal death, having to go through the same rigmarole and requirements, might it not also have negative consequences on the mother's health?
Yes.
So is that a place to do things?
I wish.
I mean, couldn't you risk infection or
Yeah.
compromised future fertility?
Yes.
The 20-week ban has an exception for like if you were literally going to die. But it can't be like, you might get an infection, so let's do this to protect you from that. It's like, oh crap, this person is about to die unless we do this right now. It's very narrow and it's very cruel, and a lot of the people who bring forth laws like this just have blinders on about protecting what they see as life beginning and conception, and are not really receptive to anything else because they're so narrowly focused on that. I don't even know if they always realize the harm they're inflicting. I do think well enough of a lot of the folks in our state legislature to hope at least that many people would be said, do you think women who have miscarriages should go through this? They would say no, but there's just a lot of psychology going on in there. Yes, ma'am.
I have a niece that had her fetus die in utero at 21 weeks, and they delivered the baby, but it was in Ohio, and they have a law in place that they had to have an actual funeral. They had to go through that at 21 weeks. Does Georgia have anything that says you legally have to have a funeral, the fetus must be buried?
No. Texas has done that recently too, and we are watching. We always watch what other states do and prepare ourselves in case our folks get any ideas. But so far, we have not heard any word about that coming to Georgia. And we have been pretty lucky so far. Georgia, as many problems as we have around abortion access, we're probably the best in the Southeast. And a lot of that is because Governor Deal is not trying to fight the culture wars. Like, he saw what happened in North Carolina with their bathroom bill. Like, he is a business-minded man, and he's not trying to deal with the backlash of folks getting too wild over here. So that has been protecting us okay for a while, but there's an election next year.
Hang on 1 second. I'm so sorry. This thing will not stop.
It happens to all of us.
I'm trying to take a picture.
Does anyone else have any questions? Yes.
I have read about impact statements that have been used, like that have been read, or that, like there's been like laws that have been enacted to allow for impact statements to be read before state legislatures or courts regarding like someone offering like an expert opinion or a victim opinion regarding like a court case that's involving that. Is it possible to like get something like that like before the state legislature, whenever laws or bills that are put forward can have an impact on medical issues, and like be able to say, hey, this is a medical impact statement, And it's like, before you vote on this, please know that this is what, would likely happen, as far as that.
We actually don't need a special law for that because it's built into our state legislative process. The fabulous thing about working on the state level is that it's a lot less choreographed than the federal level, and it's easier for regular folks to get their foot in the door. So during the committee process, every bill has to go through a committee hearing in both the House and the Senate. And folks, you can just walk in and sign up like it's an open mic night to testify before the committee. And we will usually, if something relevant comes up, try to contact people and bring them in and get them to sign up. Medical professionals can come and speak to their expertise, or we can get people who have experienced whatever issue is at play to talk about it, or I can just speak in my own capacity as a lobbyist who works on this stuff. But yeah, does that answer your question? Is there a part two? What didn't I get to?
Well, yeah, and you're talking about the expert opinions before committees, have you? And which is good too. And I think I don't know how they do it with impact statements. I heard recently about one or two state legislatures passing a racial impact statement that's required for state laws before they're voted on, for a racial impact statement to be read before the whole state legislature. Is that something like that, or is it different?
Oh, so what you're talking about would be if, kind of like the CBO, where if some body has to tell you how this is going to play out before you can vote on it.
Yeah.
We don't have a law like that. That would be really cool. I don't see that going anywhere in the state, partly because people would be like, this is a waste of resources, we don't need this. And also it would create some logistical difficulties because our state legislative session is only about 40 days long. So there's literally not time to do stuff like that, which is terrible because there's not time to really be thoughtful about the policies. Yeah. I wish, though. Great. Yes, ma'am.
In that Ohio law, what is the legal basis for forcing someone to have a funeral? I mean, my husband died several months ago. We didn't have a funeral. We didn't have a memorial service. He was not buried. He's sitting in a box on my desk at home. How do they force people to have a funeral just because it's a fetus? What kind of nonsense is this?
It's the justification that they put forward is respecting the sanctity of life. There is not an objective, reasonable justification
And
for
I
it.
think they told me that it was any fetus over 18 weeks, it applied to.
When you say funeral, though, are they just saying the fetus has to be disposed of properly,
No.
not that you have to have a service?
No.
I don't know.
Who pays for that?
Somebody
The
has to.
parents.
Yeah. Or sometimes, I think in Texas, it was the Department of Public Health would fund it if necessary, but there's a gravestone, yeah.
Well, you don't have to have a gravestone on anybody. I mean,
I'm not saying it makes
put in laws
sense.
on-
I'm just
on
saying
the
they
fetus
did
that
it.
we don't have on humans?
Yeah, isn't
Yeah.
it establishment of religion?
Yeah, it is.
It's,
It's a
Poor
ceremony.
Megan's got a lot to cover.
yeah. It's hard. I'm going to take one more question, and we can dig into this stuff afterwards, because I don't want us to miss out on the, skill building portion, all right?
Yeah.
Yes.
I aborted a child who was son take a regular abortion. I miscarried. I wish I had something just for closure, because it ended up my only pregnancy, and I couldn't have children. So that's, I ended up in therapy for a while, because I needed closure on that, and I never saw the baby. And that would have helped me deal with the issue of losing my child.
And that's a service that we offer when we have, our miscarriage clients. If they want to have the fetus take home and cremate, we offer that for them, but it should not be
It's optional.
yeah, because for some folks need that for closure, and some folks please no. So it just varies, and people should just be able to pick what they need. Anyway, I'm going to move on to a topic that we will probably find even more outrageous and confusing. But if we want to like nerd out about the federal laws afterwards, we can do that, okay?
We're going to Carrabba's afterwards.
All right. So, how many of you have heard about crisis pregnancy centers? All right. So, respectable number. So, what are crisis pregnancy centers? They are also known as pregnancy resource centers and limited service pregnancy centers. Good way to tell like the biases of who is speaking at this point. People who favor them use pregnancy resource centers, people who don't use crisis pregnancy centers. They used to be known as crisis pregnancy centers and then realized that pregnancy resource sounds more welcoming and supportive than they actually are, so most of them use that now. They're essentially fake clinics that exist for the sole purpose of stopping people from having abortions. They even will adopt like names and logos that are similar to local abortion providers, sometimes even setting up shop like right next door to like literally trick people into going into the wrong door. And will spread misinformation about the risks of abortion and contraception, and even spread misinformation about gestational limits just to try to run that clock out for people so they can't get an abortion. Like, yes, you have plenty of time, don't worry. It's not always the case. Some provide more medical services than others. There is really a range of services and like kind of range of legitimacy provided at crisis pregnancy centers. I have heard about some where like people go in and just pee on the stick that was purchased in the dollar store. Sometimes it's expired. Some of them are in church basements or like in people's homes. And some are more like medical clinics where you might see an actual nurse. Some provide free ultrasounds. A lot of them provide free ultrasounds. Some provide STI testing. None of them provide contraception. None of them provide a refer for abortion. They're usually religiously based, always abstinence only. Many explicitly have in their mission statement that their goal is to convert people to conservative Christianity. They commonly spread things like there is no such thing as safe sex, because if you have sex, you will get chlamydia and you will die. Very dramatic. They also say that having sex before marriage leads to emotional damage and depression and dysfunctional relationships. They say that abortion causes breast cancer, infertility, death. They like to be very, in the name of providing all the information, will like on their websites provide like graphic descriptions of every single step of an abortion. And if I have knee surgery or get stitches, like a graphic description of that sounds pretty gross too. And it's just like all of these really subtle things that they do to try to persuade people away from choosing to have an abortion. They also like to talk about post-abortion stress syndrome, or just say that abortion causes PTSD. There is no scientific evidence for that. There is no credible scientific evidence that abortion causes breast cancer or infertility or anything like that, but they like to put these out there as if they are true. And they often will say that, again, abortion is easy to obtain at any point in pregnancy, so don't worry about it. Take your time making a decision. And then 22 weeks in, you realize that that was not the case. They also will say that, again, condoms don't work and there's no such thing as safe sex, so everyone should just wait until they're married. It's kind of hard to tell whether you're at a crisis pregnancy center. Here are a few common signs. Sometimes they will not directly state whether they provide abortion care. For example, if folks call to try to make an appointment and ask, they'll say like, just come on in and we'll talk about that when you get here. And then you get in, they're like, oh, we'll get to that in a few minutes. And then they never do. They, of course, will not provide a refer for abortion or contraception. Often will have religious materials or language up in their waiting rooms or on their brochures. It might include a lot of language about contraception being ineffective, or all of the services are free. All of the services provided at crisis pregnancy centers are free. which of course has a disproportionate impact on folks who are more vulnerable, especially if you, for example, need an ultrasound to confirm your pregnancy so you could just get on Medicaid or something like that. This is probably where folks who can't afford medical treatment or don't have insurance are going to go. And if they provide post-abortion counseling, like no one of these is like a, yes, this is definitely a crisis pregnancy center, and of course they're not going to tell you. But if you're in a place, or someone you know is in a place and sees a good few of these, like, go ahead and leave. So yeah, what to do if you think you're at one? Ask if the people seeing you are licensed medical practitioners. They usually are not, and they just wear white coats, and they're just like trained volunteers, sometimes coming in to like do your free ultrasound, and will not tell you that. And we're really concerned about what this means for people with prenatal care, who might think that they have seen a doctor and gotten a checkup and been told like, yes, happy, healthy pregnancy, like, great, and then think that they're good and not seek prenatal care for another few months. We've talked to people who that has happened to, who went to crisis pregnancy centers, thought they received care from doctors, and like those people missed diagnosing conditions that led to miscarriage, because they take in, of course, both people with wanted and unwanted pregnancies, and aren't clear about who they are and who's providing services and what skills they do or do not have. It's very deceptive. So ask if the person in the white coat is a licensed medical practitioner. Fun fact, in the state of Georgia, they're required to have letters on their name tag, like MD or RPN or whatever. Most people don't know that. I didn't know that. So if you see someone in a white coat and a name tag without any letters on it, that's another red flag. You should ask who they are and what they're about to do to you. You could also directly ask whether they provide abortion or contraception and like pin them down until you get an answer. And be prepared to leave without pregnancy test results. A very common tactic at crisis pregnancy centers is you pee on your stick or whatever, and they take your pregnancy test, they will literally put it up on a shelf behind them or like under a bowl on the table and like not give it to you until they are done with their spiel, which might be hours. I've talked to people who've been stuck in these places for hours because they just needed to get their test results so they could like go get Medicare. We had one volunteer who was like, had a wanted pregnancy and just needed confirmation so she could get on Medicaid for pregnant women. And they kept her there for like 4 hours, basically yelling at her because she wasn't married and her boyfriend was an atheist. Like, she wanted her pregnancy, and they were still like traumatizing to her. Imagine what they're like for young women who want abortions. How to raise awareness of this. Oh, also fun fact, a lot of school boards contract with them to do the sex ed in the local schools, which is appalling. Sometimes I just laugh at these things because they're horrifying, and that's all I can do. So, if this is appalling and you want to raise awareness, please tell everyone. Like, just tell everybody you know that this is a thing. They are very sneaky, and most folks don't know about it, and it's hard to, a lot of folks ask, like, what can we do legally to shut them down, and it's really hard to get a law passed when no one's going to call their representatives about it because nobody knows this is a thing. You could host a house party or become a house party facilitator. We have developed materials to basically like have about 10 friends over to your house and play some games that help educate people about crisis pregnancy centers. I would be happy to like train folks on how to facilitate those yourself, so you can just like get those balls rolling down here. It's a really easy and fun way to educate folks on the topic and on what they can do about it. You can also educate yourself and others on the health implications of this. I try really hard to always bring in the other health aspects that are at play in crisis pregnancy centers, like the fact that they often tell people that condoms don't work, and for example, Atlanta has some of the highest rates of HIV in the country. That is very dangerous to be like telling people not to use condoms in that climate. But people tend to see crisis pregnancy centers through the lens of their views on abortion. So if someone thinks abortion is bad and there's this place that tells people not to have abortions, then that's fabulous, right? And they don't always understand that there's a lot of unintended side effects happening as well that we could probably agree are bad. You could also write an op-ed or letter to the editor of your local paper about it, raise some awareness about this and the fact that they sometimes do sex ed in our public schools, and talk to your elected officials. Yeah. Does anyone have any questions about, yes?
Well, I see a counter to all this.
Mm-hmm.
I think a group like yours should sit down with Nan O'Rourke and work out a whole system of regulations. Since we pay taxpayers' money to these groups, I think they need to be regulated. I can think of all kinds of things you could regulate on and by and for. But it would take a group like you and Nan with her ability and her knowledge to carry through. But it would take a concentrated effort. I mean, you may never get it passed, but you sure could make hell for it.
We're working on it. And I want to
start with the counselors. Demand that they have licensed counselors.
So here's where we are a little bit stuck on that. Because they don't charge for their services, they're in this sort of weird legal gray area where it's not like false advertising, it's not false statements, because those technically only apply in commercial settings. Regular people can run around saying whatever lies that they want. That's the great thing about the First Amendment. We cannot legally stop them from saying that abortion causes PTSD. They can say that if they want to. Some states have started to experiment with forcing them to say, like, have a sign on their door, for example, saying that, like, we do not have licensed medical practitioners, or we are not a healthcare facility, or something to that effect, and those always end up in court and they have really mixed results. There's a California case that is going to the Supreme Court on this next year, so I hope that that will shake out one way or the other, because that's like, we want to, and we want to do something that's legal and is not just going to end up being sued all the way up to the Supreme Court. So we're kind of waiting until that, waiting to see what the Supreme Court says before we decide how to move forward. One thing we're trying to do, though, is that one thing that is clear is that the government might not be able to tell them what they can and cannot do, and because they're like nonprofits that don't charge for their services, that really impacts the way that they can be regulated and what can be required of them. And of course, right now, our state government is very, very, very pro-crisis pregnancy centers, mostly because they are very, very, very anti-abortion. But while we're working on moving the ball forward legally and getting legislation passed, we can all be hooting and hollering and like screwing and yelling and telling everyone that we know about this. Because right now, I could bring forth all the legislation that I want, and if people aren't hearing from their constituents on it because their constituents don't know, it's not going to move. So we have to start by educating folks.
Or picketing them like they do the abortion center?
A lot of people like to do it. I personally believe in maintaining the moral high ground, and I have seen how traumatizing the picketers can be for patients at our clinic, and I don't want to impose that on people who have the misfortune of walking into the home
just
door.
with stuff that says there are no medical providers here.
Yeah.
You know, an educational picket.
Yeah, some places.
Not a screaming ugly one.
Some people are starting to do it. You could do that if you want to. There are 2 crisis pregnancy centers in Columbus. Forgot to write down what they are. I'll send that to Canada when I get back to the office. I can look it up.
One of them is Sound Choices Pregnancy.
That's it.
What's it called?
Where we used to drive past it.
Where is that road?
It's off Winton Road. It's by, I think, Domino's Pizza. Is that it?
And then there's one on Rosemont.
Yep, those two, I remember. I had them in the PowerPoint and then it was way too long, so I took them out. But those are it, I remember. Any other questions about crisis pregnancy centers? Yes.
So, do all crisis pregnancy centers, like, if there are law backing them, and do they all have to be pro-abstinence? Or is it primarily even options in regards to that? Because apparently, it seems like it's specifically directed to, like, the vicinity of any abortion clinic or birth control clinic. Is that something that they have to be able to say, or like are there other like sort of centers that may vary? Are there like is there a gray area?
There is no body governing them. So there is no requirement or oversight that like you have to say XYZ thing. But I have never seen or heard of a crisis pregnancy center that is not abstinence only. They all tend to be rooted in like very conservative values about sex and pregnancy and marriage, or like very conservative Christian values. So that's just like a constant that they just all have in common. There was another part here. Oh, right. But our state does fund them. There was a grant program that was created for them in 2016, giving them $2 million. That money can fund up to 85% of any given center's budget, on the condition that they do not refer for contraception and do not provide or refer for abortion. And that's pretty much it. There are very few requirements on that grant program. It's basically just like, here's your money, have fun, don't tell people to have abortions. Yeah.
And where does the grant money come from?
I'm trying to figure that out. It was in the first bill that created the program. It came out of our Indigent Care Trust Fund. But there was a new bill this past session that tweaked the grant program. And it did take out the part about the funding coming from the Indigent Care Trust Fund, but it did not specify where it's going to come from instead. So I have not yet had the chance to, but I want to, or realistically will probably ask my intern to dig back through the budget bill from this year and see if we can figure out where that's coming from. Any other questions? All right, on to the fun part, because it's all been not fun yet. Okay, so this is just a tool to keep in mind for strategic planning in your organizing. And as you are deciding what to do about any given issue, let's use like federal healthcare bills as an example. It's really easy to jump to like, the AHCA is horrible, let's jump through to tactics and protest. That's a really easy instinct that all of us activists have and have to kind of resist to be our most strategic and effective. So first we want to zoom out and start by defining our goal. Like, what exactly is it that we want to accomplish around this healthcare bill? So for example, like, it would be great to defeat the bill. Realistically, maybe to get a ton of people to call their senators and talk about it. And then we have to think about the power analysis and who we want to target. So in this case, when we were deciding how to react to the healthcare bill, we had to sit down and realize, like, okay, we only are here in Atlanta. We cannot lead a lobby day in DC. We have limited capacity. And we have 2 senators. Who do we target? Do we want to call all of them? What is the most effective use of our time and energy? We chose to focus on Senator Isaacson because there was actually a chance of changing his mind. So we focused on getting folks to call him because that is just what we could do. And then strategy might be trying to like really change the power relations or really get folks engaged on the issue. And then what tactic do you want to use that will help you meet all these things? If you want to defeat this bill and get people involved, you can only have the energy to target one person, and you want people to like get up in arms about it. We did phone banks. We called people and then patched them through to talk to their senators. And that was really effective. But to just, the Sparkos version of this would be just to take a minute and zoom out and think about what is it that you want to accomplish in any given action that you take, in any response that you're having, and then figure out what is the best way to do that. I'm going to try to yell above the rain. Let me know if you can't hear me.
The microphones work. You stand in, just
Can you
stand
hear me?
there.
I've been yelling this whole time. All right. Do we have any questions about this? Okay. We're going to move on to the interactive stuff. So you all have your handouts. You should see this, or it's on the back of the one that has people's faces on it. So, what we're going to do is we're going to get with a partner and decide how we want to respond to the problem of domestic workers are not protected by many laws and are vulnerable to exploitation and abuse. So, for example, most labor laws don't actually apply to domestic workers. So, here are a few possible solutions to that. You could run grievance campaigns against the worst employers. You could set up a fund for workers who have had their wages stolen. You could develop a public education campaign. Start a domestic worker counseling center and support groups, or you could pass a domestic workers' bill of rights. You have to pick one. So, what I would like you to do is get with one partner or however many people you feel like working with, and go through these criteria in the top, and check off any one of these solutions, like does running a grievance campaign improve people's lives? Is it specific and measurable? Is it winnable? Or like on what timeline? That's also another question. Do you want to win in a year? Are you okay with working for 10 years? Would it alter the power relationships at play between domestic workers and their bosses? Does it build your own organization? And is it exciting? Does this make sense? Do we know what we're doing right now?
No.
Okay. Where did I lose you? What do we have so far?
These all things, is it going to help if I turn that back row lights off?
Probably?
I'll try it.
I can't see what y'all see.
Another reason it'll be dark.
Okay.
So we're supposed to pick one of these?
And all
So,
of that is on these papers that you have.
go through each of these solutions on the list. So start with number 1, and then you'll just go through each of these criteria. Does number 1 improve people's lives? Check.
Okay.
Is number 1 specific and measurable? Let's just say no, leave that one blank and move on. Is it winnable? Check. And then you, at the end, see which one has the most check marks. And that's the action that you want to pick. Does that make more sense? All right. Let's take 5 minutes and go through that, all right?
These are our people we're focusing on.
The people whose faces are on the back are the next activities.
Okay.